Hello students, I Dr. Anjali Sabnis, Professor and Head Department of Anatomy, will be taking a lecture on coronary circulation. Now this topic is from thorax region. Now as per new CBME, that is competency based medical education, we have number of competencies under this particular topic and the SLOs, that is specific learning objectives, are defined. Let us see what are those competencies and SLOs. AN, that is anatomy, 22.3 describe and demonstrate origin, course and branches of coronary arteries. So this is the competency. The number of SLOs under these competencies are 22.3.1. At the end of the session, phase 1 student shall be able to describe the origin, course, branches and distribution of right and left coronary arteries separately. 22.3.2. At the end of the session, the phase 1 student shall be able to demonstrate right coronary artery, left coronary artery and their major branches. The second competency is AN 22.4 describe anatomical basis of ischemic heart disease, that is a clinical aspect. The SLO under this competency is 22.4.1. At the end of the session, the phase 1 student shall be able to describe anatomical basis of ischemic heart disease and coronary angiography, angioplasty and use of other blood vessels, especially great saphenous vein in bypass surgery. Next competency is AN 22.5. It is describe and demonstrate the formation, course, tributaries and termination of coronary sinus. The SLOs under this competency are 22.5.1. At the end of the session, phase 1 student shall be able to enumerate all the veins involved in venous drainage of heart. 22.5.2. At the end of the session, phase 1 student shall be able to describe the formation, course, tributaries and termination of coronary sinus. 22.5.3. At the end of the session, the phase 1 student shall be able to demonstrate coronary sinus and its major tributaries. So let us begin with the topic, that is coronary circulation. Dear students, how this word coronary has evolved. Coronary, the meaning is crown. When we take only the vessels, only the arteries of the coronary, like we do in the casting or the cast of the coronary arteries, then it is in the shape of inverted crown, and this is how the word coronary has developed. Now there are certain peculiarities of the coronary arteries. Let us see that. These are the vasa vasorum, that means the arteries supplying the arteries that supply the heart. We all know the heart supplies the whole body and the coronary arteries, they supply the heart, and that's why the coronary arteries, they have immense importance. These are the only branches of ascending aorta. There are no other branches which are given by the ascending aorta. Now when we say the coronary arteries, that is the right and the left coronary artery, they give number of branches, and in these branches, in this branching pattern, in this anastomosing pattern, lot of variations are seen. These are functionally end arteries. You can see in the image, now this is the anatomical end artery. So this is one vessel which is supplying this particular tissue. Another is the vessel which is supplying this particular tissue. If there is a block over here, then the blood will not flow and this part of the tissue will go under ischemia because it will not get the blood supply. So these are the end arteries. But when the anastomosis is present, then these particular block, though there is a block, there is a continuation of the flow will be there, because through this anastomosis the blood will go and then they will supply the part of the tissue. Now here in coronaries, these are functional end arteries. That means this particular anastomosis is not sufficient, and that's why the area which is supplied by the blocked artery undergoes ischemic necrosis. So they behave like functional end artery, and that is very clinically important. Now these arteries, they filled in diastole and they get emptied in the systole. We all know our peripheral vessels during the systole these are filled, and during the diastole these are emptied. Exactly reverse thing happens in the coronary arteries. We all know that the left ventricle continues as the aorta, that is the ascending aorta. When there is a systole, that time the whole blood which is present in the left ventricle that goes into the aorta, and during the diastole this remain part of the blood that comes down and that gets collected in these aortic sinuses which are formed because of the cusps of the valve of the aorta. So these are the three valves and the cusps, these are present in the aorta. So that blood comes over here and gets collected in the pocket, and from that region only the coronary arteries they take origin, and this is how this blood which is collected in the pockets or in the sinuses that gets poured into the coronary arteries. So this is the peculiarity of the coronary artery. So there are two coronary arteries, the right coronary artery and the left coronary artery. Now this is the heart, this is the sternocostal aspect of the heart. This is the right coronary artery, this is the aorta, and see from the right coronary, this is from the aorta, the right coronary artery that takes the origin from the anterior aortic sinus, and then it travels like this, and then it gives number of branches and supplies the right part of the heart. While from the posterior aortic sinus, the left coronary artery takes the origin, gives number of branches, and then supplies specifically the left part of the heart. Now under these headings, that is origin, course, branches and distribution, we will see each coronary artery, that is the right coronary artery and the left coronary artery. Now we will see the right coronary artery as we have seen in the previous image. Here you can see the origin of the right coronary artery, that is the anterior aortic sinus. Now once it takes the origin, now it passes in the groove between the right auricle and the right ventricle. This is called as right atrioventricular groove. So in this groove, this right coronary artery that passes, and on its way it gives branches as the conal branch, atrial branch, synodal branch, then it is right ventricular branches, and at the margin, rather at the right border of the heart, it gives right marginal artery. When it turns and goes on the posterior inferior aspect here, it is continued as posterior interventricular artery, that is a PIVA. So this branch it is given, or it is a continuous from the right coronary artery. On its way it gives these ventricular branches. So this is the origin, the course and the branches given by the right coronary artery. So what are the branches? We will just enumerate the branches. These are the marginal branch, posterior interventricular branch, right atrial, right conal, synodal, terminal branches. These are given by the right coronary artery. What is the area of the heart distributed by the right coronary artery? It supplies the right atrium, then the right ventricle. Right marginal artery supplies the right ventricle and the apex of the heart. So this is the distribution of the right coronary artery. Now let us have a look for the left coronary artery. So from the posterior aortic sinus, the left coronary artery takes origin and then it comes on the anterior surface. When it comes on the anterior surface, now this is called as the stem of the left coronary artery. Here it divides into left anterior descending artery, and then it turns and goes back, and that artery is called as a circumflex artery. Now this artery, it gives number of branches that supply the left ventricle as well as right ventricle. This is the diagonal branch, this is the marginal branch, and it goes on the posterior side. So this is the circumflex artery, and then here it gives number of branches which supply the ventricle, that is the posterior aspect of the ventricle. AV nodal branch most of the time is given by the left coronary artery. If it is not given by that, then it is given by the right coronary artery. These are the branches, these are called as the conal branches, which are given by the right coronary artery and the left coronary artery. Remember students, when this conal artery, it takes origin separately from this ascending aorta, the incidence is very less, but if it comes directly from the aorta, then this is considered as third coronary artery. Now what are the branches of left coronary artery? The branches are left anterior descending artery, diagonal artery, ventricular, left atrial, left conal, AV nodal, and the circumflex branches. Now the distribution of the heart, how it is supplied by the left coronary artery. The left circumflex artery supplies the left atrium and the left ventricle. Left anterior descending artery, that is called as LADA, it is supplied by the right ventricle, left ventricle, and the interventricular septum. The left marginal artery supplies the left ventricle. So this is the whole distribution of the right coronary artery and the left coronary artery. Now let us see the blood supply of the conduction system of the heart. SA node, which is present in the right atrium, it is supplied by mostly by the right coronary artery. If it is not supplied by right coronary artery, it gets the blood supply from the left coronary artery. Similarly for the AV node, both the arteries they supply, but mostly it is coming from the left coronary artery. The AV bundle, it is getting blood supply from the right coronary artery. The right bundle and the left bundle, both of them get the blood supply from the right as well as the left coronary artery. Now there is a component which is called as a dominance, and it is specifically dependent on the PIVA, that is a posterior interventricular artery. Now posterior interventricular artery, if it is given by the right coronary artery, then it is called as a right dominance of the heart. In most of the people, that is in 70% of the people, the right dominance is seen. In 20% of the people, left dominance is seen, where the posterior interventricular artery, it is continued branch of a circumflex artery. When this is given by the circumflex artery, the right coronary artery, it ends over here. Similarly, for the right coronary artery, if it is continued as PIVA, the circumflex ends over here. If PIVA, that is the posterior interventricular artery, it is formed by both the arteries, equal contribution of right as well as left coronary artery, then it is called as codominance or balanced dominance, or it is also called as a bilateral dominance. Now right coronary artery and the left coronary artery, both the arteries, they anastomose or they join with each other. So at the apex here, the LADA, that is the left anterior descending artery, it comes in the anterior interventricular groove that reaches the apex, and from the posterior side, the PIVA, that is the posterior interventricular artery, that gets anastomosis with this. So there is a communication between the right coronary artery and the left coronary artery. Similarly, on the posterior surface, the circumflex as well as the PIVA, they also anastomose with each other. So the communication between the right coronary artery and the left coronary artery is maintained. Now there is a concept of myocardial bridges. When the artery that passes through the muscle and again it comes up, then this particular region, it is called as a myocardial bridge. So this is the artery, that is the left coronary artery, it passes below the muscle and it again comes up. So the artery which is passing beneath this muscle, it is called as a tunnel artery, and the muscle mass which is present on the coronary artery, it is called as myocardial bridge. Now coming to the venous drainage. Whenever we see the arterial supply, we have to always look towards the venous drainage. Now the venous drainage is mainly because of the coronary sinus. Now the coronary sinus is present in the posterior aspect of the atrioventricular groove. So this is the atrium, this is the ventricle. So this is the posterior aspect, and this blue part, it is depicting this coronary sinus, and this opens in the right atrium. So this is the open part of the right atrium, and this is the opening of the coronary sinus, and it is guarded by the wall which is called as the Tpoic's wall. Now in the coronary sinus there are many veins, they open, and these are called as tributaries of the coronary sinus. Now there is one important vein which is called as the great cardiac vein. So in the diagram you can see this is the great cardiac vein. It begins near the apex of the heart and accordingly in the anterior interventricular groove, and then it is more towards the circumflex artery, and it terminates at the left part of the left end of the coronary sinus. Then there is middle cardiac vein. It accompanies the posterior interventricular artery and it opens in the coronary sinus. The oblique vein of Marshall or oblique vein of left atrium, this runs in the posterior surface of the left atrium and it drains into the left part of the coronary sinus. There is a posterior vein of the left ventricle. Now this posterior vein of the left ventricle, it runs on the diaphragmatic surface of the left ventricle and it ends in the middle part of the coronary sinus. There is a right marginal vein, it accompanies the right marginal artery and it drains into the small cardiac vein, or it directly opens into the right atrium. There are number of veins that directly open into the right atrium. So there are 3 to 4 cardiac veins, they directly open into the right atrium. Veni cordis minimi or the Tpoic veins are there, they directly open into the posterior wall of the right atrium, and the small cardiac vein that may directly open into the right atrium. Now coming to the applied aspect. Now we know the coronary arteries, their origin, their branches, their distribution. Even we are aware of about the venous drainage of the heart. Now how it is clinically important, through clinical aspect or applied aspect we will see the applied aspect of coronary arteries. Now coronary artery disease, it is a very silent killer. It is because of the deposition of the plaques into the lumen of the coronary arteries, and because of that the lumen it is reduced. Once the lumen is reduced, the blood supply towards the tissue it is reduced, and then there is a ischemia that happens, and then there is a myocardial infarction can set in. So this is very, very dangerous. Once these vessels, that means the right coronary artery, LADA, that is the left anterior descending artery, and the circumflex artery, if these 3 arteries, these are involved, that means the lumen is narrowed, then this is called as the triple vessel disease. Then the life is in danger. To diagnose where is the blockage, how many are the blockage, which vessels are involved, there is a technique that is used which is called as coronary angiography. So with the help of dye and catheter here, the number of vessels, these are seen on the X-ray, the films. If there is a blockage, then that dye will not pass, and this is how the blockage that is identified, and it is called as coronary angiography. Now to correct that particular narrowed lumen, the stents or the balloon angioplasty that is done when because of the balloon, this narrowing part, this is made to the normal. So because of the inflation, you can see here the narrowing it is reduced, but there is recurrence can occur in these cases. Sometimes the stents are put, nowadays the stents are put to enlarge that or to remove that blockage. Now this is a surgical procedure which is called as the CABG, that is the coronary artery bypass graft. So in these other veins, for example the great saphenous vein, sometimes the right internal mammary artery or left internal mammary artery, lima or rima. So these are used and these are taken, and then as a graft these are used into the heart and they bypass the coronary artery. So in the diagram you can see from the aorta the blood will come and then it will supply the part of that tissue or the myocardium. So the coronaries, these are bypassed because these are blocked. So if single such artery it is used, it is called as a single graft, double graft, triple graft and a quadruple graft. So this is how the number of grafts these are used. So this procedure it is called as CABG. So with this we finish this topic of coronary circulation. Lot of questions, that is the LAQs, the MCQs as well as SCQs can be asked on this particular topic. Thank you very much.